Okay, here we go. 1, 2, 3. Charles, welcome to Healthcare Untold.
Barbara, it's fantastic to be here for the second time.
That's right. We had a little technical issue there. But hey, we really want to hear about your company, HiDO Health. And then we really want to get into the artificial intelligence and the impact on health for the future. So take it away, Charles.
Okay, well, thank you so much. I'm very excited to be on the show today. What your listeners are going to hear is really about the future of care and how AI assisted robotics is going to alter health outcomes and improve their health and wellness. So, to rewind a little bit, my background is really in data science. I went to UC Davis Medical School and studied clinical informatics. So, backwards and forwards, my research is really focused around health outcomes. And I've traveled far and wide to many hospitals across the country, stayed in hotels, trains, planes, automobiles, and really spent quite a bit of time face to face interacting with the different people and the different systems that have a lot of input into how we're doing and what they're doing in order to impact care.
That's great. I just saw a video yesterday on real robots, and one of them was a medical care robot. So I was like fascinated by that whole process. And it is really important, particularly as you talked about across the country. We have different levels of acuity, different levels of even, really improvements that are going on, particularly in rural areas where they don't have as much care as in other parts of the country.
And as you mentioned, you speak a little bit about health equity. Health equity is really based upon socioeconomic income, location, age, gender, race, and different types of disparities based upon chronic diseases and access to care. And what's interesting about AI assisted robotics and HIDO and other type of like devices that support health equity and a standard, no matter where you live, no matter what your educational level, it brings a standard level playing field for all. So when we start thinking about equal access for everybody, these are the types of technologies that are going to have impact on many millions of people in the future.
Well, tell us a couple of those technologies that you're seeing.
Yeah, so right now, AI is very popular in the news, and you're hearing about, different software applications for people to utilize. But the AI robotics that I'm speaking about are really the ones that live in your home. So you've probably seen some thermostats, you've seen some cameras. Most folks are familiar with a microwave and a refrigerator. But what I'm talking about is automating medication dispensing at home to ensure people have disease regression or stabilization. And that can only happen if you can monitor the behaviors of those type of medication intake. So let me give you an example. If somebody has cardiovascular disease, maybe is a few pounds overweight and has diabetes, those medications are prescribed to you by either your nurse or a physician, and any deviation in your regimen or your patient or your medication intake is going to be reflected in your blood work, and finally with hospitalizations or ER visits that may be unnecessary. So these AI assisted robotics have the opportunity to alter behavior. And that alteration in behavior has significant impacts in patient outcomes or people's well-being and health.
Yeah, I have a brother with Parkinson's, and I spent 3 days with him to kind of figure out what was going on with his medications. And we had to do that manual med set. And I left there still kind of anticipating was the supervision of his medications going to continue in that way. And I looked at your machine there, and it seems like it really provides that kind of directive for people. But how does it change behavior?
Great question. So think about the HIDO device, which stands for Health Information Data Outcomes. It's an assisted robotic device for the person to depend on versus a caregiver. So let's take your example with your brother and Parkinson's, right? So you have to physically go there in person and help assist. So instead of that happening, imagine a device sitting in the home and your brother going up to the unit, it unlocks with Face ID, or if he has the motor skills, he can put in his passcode. Then he'll dispense the medications according to how his provider, nurse, or physician wants him to take it, dispenses for him so he doesn't have to open up a cup because maybe he doesn't have those motor skills. and then he can jostle them in his mouth, and we have a recording. So we verify and validate that he's taking the medications according to the frequency, the time, the dosage, and we even track the count. So we know when he's going to run out and when he needs a new bottle.
That is so cool. And, I really think that, how do we, one of the questions I have for you is how do we make that in an equitable way? Because I'm sure your device is, I mean, we all have to find sponsors for the kinds of things that we create so that it becomes, a paid, could be paid through Medicare or through Medi-Cal. Is that kind of how you're looking at that?
Yeah, so this is the way that folks get their hands on this particular device is really comes down to health plans trying to divert some of the cost of care. So right now, major health plans are paying for unnecessary hospitalizations and ER visits, and they're already paying for the medications. Now, copays may change accordingly, depending on your plan, but patients that get this device are paying nothing for the device. So when you start thinking about leveling the playing field is this, top 1% of patients utilize 39% of all healthcare expenditures.
That's right.
So let me repeat again.
Yeah.
1% is spending 40% of the dollars. So if a health plan can potentially save a substantial amount of money by pushing out these devices to people in need already, that's a win-win for everybody. So
Absolutely.
patients don't pay, health plans are able to decrease costs, and you reduce the burden on the hospitals that don't have the capacity to service these recurring, patients that are coming over and over and over again.
And it's not just health plans, because if you think about the in-home health support that people get, my brother's is paid by the state. That means that his caregiver can focus on other things. So that qualitative piece, just because they could spend the 4 hours filling his med set, making sure he's taking his meds.
Well, in addition to that, you start thinking about the caregivers that are helping assist patients at home with assisted daily living activities. Instead of them fumbling around with all the different medications, or maybe they don't have a bottle, or things are missing, or they're expired, they can focus on the person there. So, what do
Exactly.
they need to improve their health and well being? Do they have a clean living area? Do they have food in their pantry? Other elements where they can focus on the person, or maybe instead of doing this in lieu of, maybe they're just having a conversation, and then you can actually get to the well-being of that person, the happiness, because they have the ability to have those conversations, whereas they would be pushed down a
Focused.
different direction and
Right.
focused on medications, which
Exactly.
it should have already been taken care of prior to their arrival.
Well, I really love that idea. And I saw you showed me some of the devices before our podcast. And so, without telling us some secret sauce, where are you going? The next piece of this.
Yeah, so the HIDO device, we're in discussions with some major health plans, and we've spoken with some other larger government institutions, and our goal really is to impact care and to alter the way home care is looked at. Right now, people are focused within the confines of the hospital and the four walls of a clinic, and those are sterile environments. But the
Yes.
home is really an unknown dynamic that nobody's really categorized and created transparency, accountability. It's really been a black hole. So what the HIDO device does, and what we're trying to accomplish, is really create transparency and accountability and clinical dashboards so we can intervene with folks that need it. And the ones that are doing fine with the device, they can be focused on other areas of their life and wellness and live it, versus going down a lane where you're chasing medications and you're chasing the problems. Our goal is to basically improve the lives of many people, no matter age, gender, race, or disease.
So that data would be given, sent to the provider, and they could see, hey, he's not taking his medication correctly. We're going to have to figure that out. And there you go into an intervention to ensure that that medication is being taken well. I mean, and you think about these medications for so many of these diseases, they're doing pretty good in some of these cases, in terms of some of these spectrums like Parkinson's. I can just see the medication and its impact on my brother's movement. And so And I saw when he wasn't taking it and the impact. And in fact, he was hospitalized from a fall. And so I can see that this is an incredible new direction for us. And one, like you said, is going to save millions of dollars, billions of dollars, and that we can really get into that care model, which is at home.
hmm Yeah, and if you think about it, physicians and nurses wouldn't be categorically looking at these videos in the back end. It would really be a population health team or a group
Mhm.
of case managers that can look through the entire population, and then if needed, a doctor or nurse could be notified if a patient was deviating off of medications that were mission critical that would lead, to your point, to a hospitalization or unnecessary emergency room visit. And that's good for everybody because now you have care going to the ones that actually need it versus just trying to blanket everybody, because we don't have the type of labor that we used to have to provide that level of care. And even from a caregiver perspective, we're going to have an ongoing shortage of folks being able to even go to the home. So you need to really pinpoint and isolate where people need to spend their time and energy based upon the needs of that population.
And we have an aging community, so that population is just going to grow for need. And so your device and many others that I'm sure going to come in the future are going to be incredibly effective for people and their care.
Yeah, every day, 10,000 people, 65 years of age, every single day, 10,000 new ones that have just turned 65. So there's a
Wow.
significant aging community. That's just in the United States, not throughout the world. So you start
Yeah.
thinking about that population, and then each year, over 6 billion prescriptions are filled in the United States alone.
Wow. Well. Well, what are you most excited about? I know you're excited about what you're doing, but what's outside of your sphere that you really want to get your hands on in terms of care?
Yeah, I think the ultimate goal is to create a blueprint for health. So in theory, it sounds simple because we're a pretty sophisticated society, but in reality, healthcare technology is a bit archaic. People are still using fax machines, and that's the reality of the situation. So now, if you peel it back, the way to create a blueprint of health is really there's a couple of basic steps. There's two major lifestyle intakes. These are primary inputs. So you have food and nutrition, and then secondarily, you have exercise and movement. And if people have challenges with those first two, and they don't, and typically disease to a chronic disease state, and then that means that they're on some type of medication protocols. So if you struggle with one and two, which is diet and exercise, then you usually are on a series of medications. But if you struggle with the first two, generally you struggle with the third one also.
Yeah.
And that's why we have this revolving door. So let's take the example of your brother that has Parkinson's. So he may have issues with mobility. He may have issues having access to a particular type of food. So now he's on a series of medications to deal with his debilitating disease, and he's probably having complications even trying to get to the right medications or make sure that he even has access to those and he's able to take them on a regimen. Especially with Parkinson's disease, when you have these specific medications, many of them are not just taken once a day or twice a day, but they
That's
might
right.
be taken 6 times a day or 9 times a day. And if they don't take them, then they're rendered motionless.
Right.
And that is very, very serious and traumatic, not just on the patient, but also the family members. So you have an entire ecosystem of people that are being impacted based upon not knowing the blueprint of medicine. And I believe that by knowing the different cocktails and medications, mirroring them up with the blood work, which is your secondary endpoints, and then finally pairing them with your hospitalizations, readmissions, ER visits, and final outcomes, you build an ecosystem, a life cycle, and you can now select for the first time when it comes to precision medicine which drugs are most effective for which patients based upon location, based upon geography, based upon age, gender, race, chronic disease state. And then you can finally treat people with precision medicine versus right now, which is empiric treatment, which is based upon the clinicians, where they went to medical school, what's their medical experience, and their patient population they serve. They do the best they can to treat you empirically, which is their recommendation for medications. And then it's a bunch of variability throughout the country is what we see.
well, I call it ruling out, right? Ruling it out for that. And then somebody doesn't do well with that medication, they rule you in with another medication. So this precision medicine will really, really, really impact us. I saw that you had on LinkedIn the other day, you talked about not only was it precision medicine, but it's mind, body, and spirit, which, I think we forget how powerful, our spirituality, our thoughts on our own body, and really having that kind of perspective of health does have an impact on us from a health perspective. And so I really like that part of that blueprint. You also had the power of genetics insights. And I wonder if you would say something about that, because I think that's an incredible perspective. I'm Native American and Latina, and I know that there's different things that have happened in our communities that are different from other people.
Mhm. So now, you have to think about this in the future. Think about a wide proliferation of HIDO devices residing in the home. So now you have a representation of all these diverse populations. And you can isolate now with those populations and locations the types of medications that they're getting, those types of secondary outcomes, so their blood work, and those final outcomes. And you can determine what those best solutions could be for those types of groups. But right now, most of the clinical studies that go on and most of the type of data that we're receiving is really skewed to a specific type of group that they can recruit for studies. So they're not a great representation of everybody. So we can really get down to the nitty gritty when you start talking about precision medicine and genetics to what would be most effective from a clinical standpoint by having the units out there and collecting that data so we can service people differently.
Yeah, that's really going to be an important part because, as you say, I worked a little bit on clinical studies, and, it's like if you don't have a certain population within that clinical study, you really don't know the impact of that medication.
Yeah, and we all have, two arms and two legs, and we do the best we can with the data we have. And you can make some assumptions based upon, clinical study efficacy and safety. But to your point, if you want to have a broad representation, you need to have a representation of those particular type of audiences that will be taking those medications.
That's right. Well, this is so exciting, and we're really so proud of the work that you're doing. Any last comments for us and our listening audience?
Yeah, I mean, I would ask your audience, if you want to know more about HIDO, please go to our website at hidohealth.com and shoot us a note. We have a newsletter on LinkedIn, The Future of Care, which you're more than happy to subscribe to. But if you have any questions about what we're doing, or you want to learn a little bit more about the testimonials and the people that we're impacting on the YouTube site, just go to HIDO Health, and you'll be able to see a number of different stories ranging from stroke to dementia to cancer to a variety of other different chronic conditions. And you can hear a little bit more about other folks that have utilized this device.
Yeah, it was really exciting. I did listen to some of the testimonials, and I've been looking at your newsletters. It's a really intriguing, and I really have a lot of hope for the future in terms of healthcare and what we can do from people like yourself, Charles Gellman,
Thank you so
CEO
much, Barbara.
of HiDO
Appreciate.
Health. Okay, thank you.
Thank you so much, Barbara. I appreciate it.
Oh yeah, that was so exciting. Thank you so much. Yeah, I'm really